neovascular AMD. Thank you.
Okay, thank you for your kind introduction. So this is an example of a macular neovascularization in 2013, and the patient underwent several intravitreal anti-VEGF injections. And this is the result after 10 years. So we can see the development of fibrosis, which is the commonest stage of macular neovascularization, and it has a cumulative incidence of 62.7% at 10 years. We still do not have a unique definition of fibrosis, and we refer to it with the definition given by the CAT study as a well-defined and elevated mound of white or yellowish tissue. What is sure is that the development of fibrosis is associated with a reduction in the best-corrected visual acuity. However, we know that in neovascular AMD, visual acuity is not a perfect endpoint. In fact, it primarily tests foveal cone function, and it has a ceiling effect. That's the reason why the aim of our study is to analyze retinal sensitivity over macular areas affected by fibrosis due to neovascular AMD using the microperimetry. This is a brief sum up of what is microperimetry and the three different maps that we can do with the microperimetry. So a mesopic map, which is a kind of exam done under medium light condition with an achromatic stimuli that tests both rods and cone function. We can also do a red scotopic microperimetry, so in this case the exam is done under dark condition with a red stimuli, and we know that for red stimuli, the sensitivity of rods is similar to that of cones. So also in this case we test both the two photoreceptors. And the last one is the scotopic microperimetry. Also in this case the exam is done under dark condition but with the stimuli that only test rods function. This is an observational study in which we analyze 30 eyes coming from 30 consecutive patients that we followed at our clinic in Milan, Luigi Sacco Hospital. And all the patients were then divided in two different subgroups according to the presence of fibrosis at the color fundus photography. In fact, on one side, we had the patient with fibrotic lesions, and on the other side, the patient with no fibrotic lesion. All the patients with fibrotic lesions were then divided in three different subgroups according to the location of fibrosis at the DOCT. In fact, we had the subgroups with patients with fibrosis under DRP, patient with mixed fibrosis, and then patient with subretinal fibrosis. For each patient, we did the multimodal imaging. And on the other side, we had the patient with no fibrotic lesions, and so just with macular neovascularization. Each patient did first the mesopic microperimetry, and then after 30 minutes of dark adaptation, the red scotopic and the scotopic microperimetry. This is an example of what we did later. So we identified our lesion, and then with ImageA, we co-registered all the images that we obtained with the microperimetry, and we did this with all the three maps, and we calculated the average of the retinal sensitivity values in the involved area. We also wanted to evaluate the area outside the lesion, and so also in this case, we evaluated the average of the values in the two grades outside the fibrosis. So this is our results. As regards the retinal sensitivity over the lesion area, we can see that patient with no fibrosis or patient with sub-RP fibrosis had the higher values of mesopic retinal sensitivity, and we also had the same results for the red scotopic retinal sensitivity. As regards the scotopic retinal sensitivity, all patients had low values with no significant differences between the four subgroups. As regards the retinal sensitivity outside the lesion area, we can see that in this case, only patients with no fibrosis had higher values of mesopic retinal sensitivity, and the same results for the red scotopic retinal sensitivity. But also in this case, scotopic retinal sensitivity appeared to be reduced in all the four subgroups with no differences between the four groups. With the multivariate analysis, we also try to identify which factors influence our retinal sensitivity, and we had significant results for the presence of fibrosis at color fundus photography, a reduction in the subfoveal choroidal thickness, and the disruption of ellipsoid zone and external limiting member. So these three factors seem to be predictable of low values of retinal sensitivity. So this is our conclusion. Patients with sub-RP fibrosis are the ones with higher retinal sensitivity compared to the other types of fibrosis. The onset of fibrosis is associated with a reduction of retinal sensitivity also in the area outside the lesion. And then the scotopic retinal sensitivity is reduced in all the subgroups, and this is due to the generalized rod dysfunction, which is typical in all patients with AMD. And then that fibrosis, choroidal thickness, and the loss of the outer retinal layers seems to be the best predictors of a reduction in retinal sensitivity. Thank you.
Thank you so much, and we'll continue for the last talk. I'm inviting Alexandra.